All right, welcome back. You're back with us on the C Morning Show. And for our second talk show, as mentioned before, now we're going to talk about liposuction,
Yes,
right?
we are, Tommy. Exactly. Now, recently, right, there has been a case in Medan in North Sumatra where a celebrity allegedly have died after undergoing liposuction at a beauty clinic. And as a response, the general chairperson of the Indonesian Medical Association, Dokter Moh Adib Khumaidi, reminded the public to be more aware in choosing doctors or medical facilities before taking liposuction.
That's right, Karina. And in some cases, some people are not yet familiar with the surgery's procedure and only consider it as a shortcut to make them look better. And to learn more about liposuction, as well as its procedure and risk, we are now joined with dermatologist Dr. Kardiana Dewi. Good morning, Doc.
Good morning, Doctor.
Hi.
Thank you for joining us.
Thank you.
Of course, I'm very happy and pleasure to be here.
Yes. Now, Doc, let's just get straight into it, right?
Yes.
Now, it seems like many people are indeed talking about liposuction, and there are lots of truths and myths around it.
Yeah.
Right? Could you maybe tell us a little bit more about this type of surgery and the level of risk it brings?
Yeah. So actually, liposuction is a procedure that we remove excess fats in specific area of the body. So it can be like everywhere you want. It actually has to make a good proportions and to make you look better. And mostly the area that patients or the clients wants is like the abdomen. You can do it on the thigh area, also on the buttocks, and also sometimes at the back. The upper arm, yeah. And then now also on the face, like on the chin, if you don't like it. So,
I was covering my here.
so the purpose is to remove the excess fat that stay there, but then we want to make it look better, but not too much. So of course, this is for body sculpting, but not for losing weight.
I see, because you have to maintain it still.
Yes,
right?
yes.
But, you know, based on the story that we start with,
Yes.
what kind of problems that usually people face when they try to look slimmer, for example?
Yes.
Didn't they get enough information, like a proper information to get that kind of procedure?
So actually the basic thing that we want to do, when people want to do liposuctions is because like, first they don't want to, like they want to get the instant results, of course.
Yes.
But actually the indications is that you already change your habit, you already do the exercise regularly and everything, but still there are some parts that you cannot remove.
Right.
That's the principle of liposuctions.
I see.
There are some parts that you cannot reduce by the normal and daily habits that you already do the best, but then it's still there, then you can do the liposuctions. But there are actually also another indications, like the thing that you can do liposuctions. For example, if you get really big like a weight loss, and then some part are still very flabby, and you cannot get it out, then you can do liposuctions. Or sometimes, like we call it gynecomastia, there are some men who has quite a big breast. So we can reduce it by liposuctions. So it's actually not only for as cosmetic procedures. We can do for special indications as well.
Right.
But nowadays, because like, I guess having a body goals is already our main thing since the social media and everything. So when people like feel like, I don't have enough time, I want to have the instant results, they just try to do it immediately without even considering all the risk.
Right.
So that's become like the problem nowadays.
Yeah, the stigma that people sort of go
Yes,
after.
yes.
Oh, I want, you know, you go through social media and you see someone with a really nice bikini
Yes.
body and you're like, I want that tomorrow.
Yeah,
And that's kind of the
yeah.
mindset people have,
Yes.
right? But for the actual procedure itself, what kind of state or rather condition do you have to be in? Obviously, you can't just do it in an instant. You have to consider your health conditions as well. So can you maybe walk us through the process of these considerations that we need to take before we...
Yeah, of course, we have to get like the thorough investigations and examinations by the doctors, the board certified and experienced doctors. And then, of course, you have to be in a healthy conditions and non-smokers.
Non-smoker.
Yeah. And then, of course, mostly it was expected to be you are at or near your ideal body weight. So this is not for obesity.
Okay.
And of course, there is no other specific medical conditions that can lead to more complications.
Yeah.
So if we say like that, then it means that what is the condition that we cannot do? Of course, first, if it's like the patient has significant obesity,
Yeah.
better not. And also like specific medical conditions like diabetes, you have the heart disease, heart problems. And then you have a specific medical condition that make you have to take medicine all the time. And maybe that specific medications can increase the risk of complications you have to avoid as well.
But why non-smokers though?
Yeah, smokers really inhibit make all the recovery less. Yeah, it's so much lower.
Oh, I see.
Yeah. So better not.
All right, that's the precondition.
Yeah.
So now, can you explain to us the techniques of liposuction?
So actually the technique, if we use the technical procedures, there are a lot of techniques. Mostly the one that is safe is we call it the tumescent liposuctions. So back then, it was like by general anesthesia.
Right.
So the patient just like sleep, you don't realize anything, but after that you need to be on the recovery room, and then you have to be like hospitalized for 24 hours, and you have to wait. You cannot go home, drive by yourself right now. But actually, it's already been quite a long time, since I guess 90s, it's already being popularized in Indonesia as well.
Okay.
We use the tumescent anesthesia. That's a method where we put like a solutions. It's a combination of a saline, lidocaine, epinephrine. The amount is quite a lot. So we put the solution inside the body, and then the solutions will make the liposuction procedures more painless and then less bleeding.
Okay.
That's the first one that we can use the technique. And then the second thing, we can also use the ultrasound assisted.
Oh.
All right,
There
this
is a lot
without
of
needle.
Yeah, with
Oh, still
all
with
of them
needle.
without the needle.
Oh, without the needle.
So
All of them.
one thing for sure, the thing that we do with liposuction is we put like a small tube. We call it cannula.
Okay.
Small tube from metal, of course. We put it on the fat layer. Then we just suction
Suck the
Just
fat.
suck
The fat.
out, yeah.
Okay, so then it like growing into several methods like that. First, like the tumescent one. Second thing, the ultrasound assisted. You use ultrasound to liquefy the fat, and after that, it's easier to remove the fat.
And it hurts
And then-
less.
Yeah. Also want to make less pain, shorter operation time. And then after that, you can use the laser assisted. Today is quite also famous. The laser assisted, the laser melt the fat.
Okay.
And it's also have a skin tightening effect.
Wow. All right.
Wow,
That's
so
like
all in
double.
one. Yeah.
Yeah. So like, and there's also quite
Thinking about it.
and then there are also the power assisted liposuctions. The power assisted means like they have some energy to liquefy the fat and then makes it easier to suck the fat as well. So there's a lot of methods that we can use for the liposuction.
Depending on the
Yes.
patient. Yeah.
So the technically, the procedure itself, it's like this. Of course, first, the doctor have to marking the area. Mark the area that want to be liposucted.
Yes.
So this area already been marked. And second thing, you have to administer the anesthesia. And then the third thing, we give like a small incision on the skin layers. Can you imagine that? Marking,
Yeah.
put the anesthetic,
Yeah.
and you put like small incisions, and you make that cannula, the small tube, go insert under your skin to the fat layer. Then we suck it. That's it. Then after that, we close it. Sometimes we can knot and then tighten it, and then put it like a bandage, or sometimes just like, if it's very small, sometimes they don't close it, just put a bandage or special tape.
And
like that.
The fastest one is the laser and the ultrasound, is it?
Yeah. Less and more like that. But like there's always a plus and minus with the machine, right? If you do it like the manually, there are also some doctors who do it manually. I mean, like you just sucked it with your own hand and your own energy.
Oh my God.
And this is, of course, you have to be like, it's more
Strong,
tiring,
yeah.
more tiring. So like nowadays, people do with the machine.
Because I saw that in some documentary
Yeah.
back in the days, like maybe
Yes.
in the 90s,
Yeah.
when you use like a very long, I don't know what you call it, like a needle or something, and then
Yeah,
you
that's
do
the
this.
thing that I said, the cannula.
Cannula,
Like, it's
okay.
like a tube, a small tube It's long, and up until now, we still use it.
You still use it?
Yes,
All right.
of course.
Even though with ultrasound as well?
Yeah, we can
Okay.
combine, like,
I'll combine.
Yeah.
Now, with all this advanced technology and combination of techniques as well, what are the side effects of getting liposuction?
so of course, there's a lot of like the short side effect that can, like the swelling,
Yeah.
Oh, yeah.
the bruise.
Yeah.
Sometimes the bruise can be a lot. Just like not mentioned, like you bump into something, a small bruise. This is like a big bruise all over the area. Like all dark purple all over the area. It can be like that. It can last quite a long time. And then soreness. And sometimes you also can feel change on the skin sensations on the area. Mostly it's not permanent, it's
Yep.
temporary. Yeah, but it's sometimes different patient can give different result and according to the procedures as well. Maybe it can last for 6 months sometimes.
6 months.
Yeah.
Downtime.
Yeah, but it soon with recovery, it's gonna be better. But of course there are other complications, the one that you don't want.
Yes.
Like the bad thing that's happened.
Exactly,
like,
to the point
yeah,
where
the
it's-
infections.
Yeah, or
The
even
infections, and
worse.
after that leaves some scars, and
Okay.
then like also like the more bleeding. That's the very hard complications.
All right, doctor, so last questions. Any tips for those who wants to have liposuction,
Yeah.
especially to get the proper ones?
Yeah.
Because we started with a
Yeah.
case there before.
Yeah.
Yeah. Of course, there's always sad to hear like a case like
Yeah.
that before, right? I guess like if there is some tragic loss after cosmetic procedures, it's a very sobering reminder that any operations, any surgery has a risk.
Yes.
So you have to make sure that when you want to do some operations, you have to choose the doctor, choose the board certified and experienced, they're specialized doctor.
Yeah.
According to the college, we call it like we have the society for all the doctors who have give us all the credits of which doctor can do. It's like this liposuctions can be done by the plastic surgeon and dermatologist because we have the dermatologic surgery sections.
Right.
So if you want to do it, you make sure that you go to a doctor that is credible, board certified, also experienced, and also with a proper technique that you already been explained.
Yeah.
And of course, the facility. You have to make sure that facility is like proper
Yeah.
and already accredited. And also for the post-care. That's why, of course, in the hospital is better, but sometimes the expenses are more,
Yeah.
of course, because they have a lot of room. If there's something bad happen, like mostly when bad things happen, they run the patients to the hospital and still like it sometimes quite far, there's traffic,
Yeah.
queue and everything.
The time.
So you cannot make it. So if you want to do it on the clinic, there are things that you should know. So actually, I guess not much people realize that there are 2 types of clinics.
Okay.
Okay.
Klinik utama and klinik pratama.
All right.
That's according to the government. All aesthetic clinics, all clinics, it divided by 2. Klinik pratama and klinik utama.
Yeah.
When you see there's klinik pratama, means there is only general practitioner who practice there. So if you see the klinik utama, is the clinic with specialized doctor.
Okay.
Klinik utama is the clinic with specialized doctor. When the name is klinik pratama, it's definitely just GP only.
I
All right.
see.
And they put it on the board,
And
right?
they
the signboard.
do, yeah.
right?
Should be.
Yeah, I've
Some put
always
it, some not.
wondered, yeah.
So you can realize sometimes
does
there's
it
clinic
mean?
pratama, sometimes
Yeah.
there's clinic, but sometimes they don't put it.
All right.
For me, myself, I don't put it because like, I guess make patients like a bit confused because my place is small. If we put like more clinic utama, it's a bit confusing, but we have the license there. We
Yep.
put it on the
wall.
on the
the
wall
wall
we put it and we
inside.
put that this is certified as clinic utama and have the license and everything.
Yeah.
All right.
That is so important.
Yes, get the proper ones.
Yeah,
that's the
especially
first.
yes, as you mentioned, a big decision like this to go under
Yeah.
any operation, any surgery, there's always a risk. So
Yeah.
doing your research and getting
Exactly.
the best, not only doctors but also facilities.
Yes.
is very important.
All right, doctor, thank you so much for sharing with us here
Yes.
today.
Thank you very much, doctor, for
Thank
coming.
you. Very
All
welcome.
great, thank you so much. So after the break, we'll come back with more interesting stories only on C Morning Show.